My name's Amy Lawden and I'm an osteopath, and I'm here to talk to you today about patient positioning during procedures. So as an osteopath, I'm a primary healthcare practitioner. We work with musculoskeletal conditions and we treat them under a biopsychosocial model using a combination of manual therapy, exercise therapy and rehabilitation. So as part of our job, we often get asked by patients about how they can best perform their daily activities with the least amount of pain. This might include how they can get through a medical procedure. Mary approached me a little while ago about a patient that she had needing cataract surgery, and they had lower back pain and they were concerned about how they would lie still for 15 minutes. So I was able to give Mary some tips on how to position the patient so they're able to successfully get through their procedure. So today we'll go through a few different examples and scenarios to tell you how you might want to use these ideas to help patients that you have in the future. Of course, if you have equipment that allows you to adjust the different areas of the table, that will make it a lot easier to put the patient in the most comfortable position for them. However, if you just have a flat table such as this, you can use pillows and towels to assist you. So the first thing to consider if the patient has back or neck pain is that we really want to support the spinal curves. But within doing this, it's important to always just get the feedback from the patient, as they'll be best be able to guide you as to where they're comfortable. So the first thing that you may want to do is to pop a pillow underneath the patient's knees, just like this, down. How bent they would like their knees will be dependent on the patient. Again, check in with them to see what they're comfortable with. What this allows us to do is just to support the lower back curve and flatten that out. However, some patients still might not be completely comfortable at this stage, so you can either use a thin towel and pop this underneath their lower back, just like this. Or the other thing that they can do, if that's not comfortable still at this stage, is we can remove the towel and they can place their hands underneath their lower back and just support it from there, just like that. Cool. So if we take this out and we'll move on to the next one. From here, the next problem they might have is neck pain. So in that case, again, it's important to just think about supporting the curve of the neck and allowing them to be as relaxed and as comfortable as possible. An easy way to do this is just with a small towel rolled up, and we'll just pop this underneath your neck here and leave that there. From here, what you want to look at is that the support isn't so high that it's bringing the patient's neck up into a flexed position, or that it isn't so low that it's allowing the head to drop back and take it into an extended position. But again, always checking in with the patient and just seeing what they're comfortable with. The third scenario that might come up is patients with shoulder pain, particularly if it's through the anterior shoulder. So in this case, patients often don't like lying on their back just because it allows the shoulder to drop backwards and creates pain through the front there. So what you might do in this scenario is just to bring a towel, just pop it underneath the patient's shoulder, just brings it forward and gives a lot of support into there. These patients will probably be most comfortable with having their hands like these are here, just onto the stomach, just so it again just supports the shoulders in that nice forward position for them. Once again, it's most important thing is just to check in with the patient to see how comfortable they are. They'll be able to give you their best feedback.